they here go to private facilities. And they pay money, let's be honest with one another. They pay money, you understand? But then we are here, we have no money, we are saying everything is free. Then at the end of the day, what kind of services do we expect? Alright, so we need to look into that. Alright, I'm not being political and stuff like that, but for me, that is just from my own opinion and what I have observed. Alright, that at least we need to improve our health system. Okay, yes, I know there's so many issues and stuff, but as I say, sometimes if you're not in the system, you know, so then they indicate to class here, understand? If they need to make a activity, they can walk, not can be, you're going to be following me, acne. You understand? But you're not really there to know those people who are there, like the sacrifices they have made and all that. How many people they have? But I say, no, they have. All that people care about is when there's a problem, then everybody is talking about it and all that. Okay, but what have you done?
Apply a palmful of hand rub to cover the entire surface of hands and fingers. Rub the solution vigorously into hands, especially between fingers and under fingernails, for 20 seconds. See procedure on how to make alcohol-based hand rub. Perform hand hygiene before or visual disturbances like silver lights or blurry vision, or persistent upper abdominal pain from the liver, or respiratory distress caused by pulmonary edema because of heart failure, or decreased urine production, less than 30 milliliters per hour or 600 milliliters per day. Eclampsia is when a pregnant woman develops generalized seizures. Usually, these women suffer from preeclampsia, though 10 to 20% of women with eclampsia have a normal blood pressure. If fever is present, consider a differential diagnosis like cerebral malaria or meningitis. Causes. Preeclampsia is caused by pregnancy and cured by termination of pregnancy. The specific mechanisms for development of preeclampsia are not fully understood. How to diagnose. All pregnant women must have their blood pressure measured at all visits to a health facility. If an elevated blood pressure is identified, it should be confirmed after the woman has been resting in a slightly reclined position. If hypertension is diagnosed, perform a urine dipstick to check for protein and assess signs of severe preeclampsia, such as headache, visual disturbances, dizziness, nausea, and upper abdominal pain. Management of hypertension. The management of hypertensive disorders in pregnancy depends on the severity of the condition. Those with mild hypertension and no severe features may go home and come back for a new assessment after 3 to 4 days. It should be warned to seek care if experiencing danger signs, headache, visual disturbances, dizziness, nausea, and upper abdominal pain. Plan delivery at referral facility at a gestational age of 38 to 39 weeks. If the blood pressure is above 150 systolic or 100 diastolic, they should remain at the health facility. Oral treatment could be started if the blood pressure remains in this range. If the blood pressure is above 160 or 110, it must be treated. To keep the systolic blood pressure below 160 is the single most important task to prevent cerebral hemorrhage, which is the cause of half of the deaths due to preeclampsia. Labetalol and methyl-dopa are recommended drugs. For example, labetalol 100 milligrams given orally can be repeated after 1 hour, or methyl-dopa, starting dose 250 milligrams orally 3 times daily. You can find relevant drugs, their indications and dosages in the drug list. If systolic blood pressure is not controlled to below 160, intravenous treatment must be started. At hypertensive crisis, blood pressure above 180 systolic or 120 diastolic, intravenous antihypertensive treatment should be given. For example, hydralazine 5 milligrams intravenously slowly every 20 minutes until blood pressure is reduced to below 160 systolic and between 90 and 110 diastolic. Diastolic blood pressure should ideally not be lowered to below 90 so as not to cause fetal distress. Severe preeclampsia and eclampsia. If a patient has severe preeclampsia or eclampsia, this is what you do. 1. Call for help. 2. Check airway and breathing. 3. Fits are self-limiting. While convulsing, prevent the woman from trauma and tilt her to one side. 4. Insert IV lines. 5. Give magnesium sulfate. As a loading dose, you give 4 grams intravenously slowly over 10 minutes. Never give magnesium sulfate intravenously fast, as this causes cardiac arrest. If no signs of toxicity, give the first maintenance dose, 2 doses of 5 grams intramuscularly, 1 in each buttock. Beware of toxicity. The first sign is loss of tendon reflexes. A more severe sign is respiratory depression with a respiratory rate of 15 per minute or less. Then you don't give the intramuscular dose of magnesium sulfate. At a respiratory rate of 12 per minute or less, or at cardiac arrest, give the antidote calcium gluconate 1 gram intravenously that you must always have available if you administer magnesium sulfate. 6. Manage hypertension. 7. Put in a urine catheter and write down output each hour. 8. Monitor each half hour respiratory rate, blood pressure, tendon reflexes, and fetal heart rate. 9. Never give IV fluids faster than 1 liter in 12 hours, as it can cause pulmonary edema. Finally, once the patient is stabilized, she must be sent with escort to a referral hospital. As the condition can become life-threatening and will progress, delivery should take place within 12 to 24 hours, regardless of the gestational age. If the gestational age is below 34 weeks, steroids should be given for lung maturity of the fetus, and delivery can be postponed 48 hours for the full effect if the condition is stable.
So how was that video? Familiar, right? Very familiar. Okay? It's not something that you don't see here. So it's something that you see almost on a daily basis. Okay? So you see how they manage it. Alright? Hypertension is not just a problem in Zambia.
Therefore, items should be divided into each procedure and sterilized, either wrapped in cotton fabric or in a small covered dry sterile container. Keep the sterilized items in a closed cabinet. Arrange cleaning and storage so activities and objects flow in an organized way from contaminated items, cleaning, decontamination, sterilization, or high-level disinfection to storage. Separate the dirty and clean areas. Housekeeping. Clean high-risk area with disinfection solutions that is made of detergent and 0.5% chlorine solution. Clean washable bed, table, floor, toilet, and delivery bed. Clean even if there was no birth at the delivery bed.
Sometimes when I want to communicate better with you, I will see use words, right? So I just re-emphasize some points, okay? But this is nothing new. Is it something new? No. It's just that maybe sometimes we are not consistent, okay, in doing it. Probably like we are overwhelmed with the job and all those things, right? But sometimes even in an area where you're overwhelmed, you still have to do the right things and the right procedures, alright? Sometimes you might feel that, okay, if I wear these sterile gloves, that is fine. Okay, you don't go and wash your hands and all that maybe after a delivery before touching, everybody see. Okay? And then sometimes you see people they come to visit. I don't know if it happens here. Because to be honest with you, I have never worked here. So visitors will come escorts and then they sit on the patient's bed. You know, we should discourage that. Okay, come what may. Yes, we live in a freedom of speech world and stuff like that. But what I have to do, I am going to do it. You understand? And I am going to tell you. Yes, I know like sometimes they approach you, you don't have to shout. Money, do this,